Not many of you know, but in under a 20-year period, over 350,000 individual Americans have died due to the use of opioid pain relievers. I'm pretty sure many of you, or at least a majority of you, will be exposed or will soon be exposed to opioids because they are commonly prescribed for pain relief, such as wisdom teeth removal, minor surgical procedures, or other things. I have personally known and met numerous individuals who have become addicted to prescription opioids, and I also have known individuals who have heroin addictions and are currently undergoing treatment. During my speech, that is why I believe that the United States government should enact more stricter laws for the use and the prescribing of opioid pain relievers in the medical community. During my speech, I'll be talking about the problems that opioids pose, that the country faces due to the opioid crisis. Then I'll discuss the solution, and finally I'll discuss the benefits of implementing that solution. First, let me give you a brief history on the opioid epidemic. The opioid epidemic began in the late 1990s. According to the National Institute of Health, the opioid epidemic started in the late 1990s due to pharmaceutical companies giving reassurance to medical communities that the use of opioids had a relatively low risk of addiction. However, studies were incomplete at that time, and they did not know the full effects and the risk of using opioids. As a result, the use of opioids increased dramatically, especially in smaller rural communities. However, the opioid epidemic can now be found in the large cities and the smallest towns all across the United States. Hundreds of Americans die each and every day. According to the National Institute of Drug Abuse, over 115 Americans die every day due to the use of opioids. Misuse of opioids include prescription pain relievers, heroin, and synthetic opioids such as fentanyl. This is not only a public health crisis, but it's also an economic burden on the United States. According to the Centers for Disease Control, the economic burden on the United States is estimated to be around $78.5 billion. This is due to the health costs of treatment, criminal justice involvement, addiction treatments, and healthcare costs. Without intervention soon, millions of Americans will continue to suffer. However, most importantly, thousands of Americans die each and every year due to the use of opiates. According to the National Institute of Health, 33,000 Americans die every year on average, and 2 million Americans suffer from substance use disorders due to their exposure to opiates. There has been many solutions that have been proposed over the years to combat this crisis. However, there's been one solution that has been successful on multiple fronts is prevention. According to the Health and Human Services, preventative measures have been shown to be most effective in curbing opioid addiction and opioid overdose deaths. But another preventative measure is by educating primary care providers on chronic pain management and safe opioid prescribing. According to the National Center of Biotechnology, a study has shown that when healthcare providers were educated or received more education on safe opioid prescribing and chronic pain management, there was a 38% decrease in opioid overdose-related deaths in Wilkes County, North Carolina. Officials in Wilkes County were able to lower the opioid-related overdoses by preventing exposure to opiates in the first place. However, if this was done on a national level, it could have a more profound effect across the country. The government can revise laws, such as the CDC guidelines for prescribing opiates in the medical community. This would force healthcare providers to rely more on more traditional treatments, such as physical therapy, talk therapy, and non-opioid treatments, and other non-opiate drugs. According to the WebMD, physical therapy and non-opioid treatments have been shown to be more effective in treating chronic long-term pain instead of using opiates as a temporary use, because they have because physical therapy and non-opioid treatments have zero risk of addiction and side effects that opiates pose. There are many benefits to implementing the solution at a national level. Millions of Americans continue to suffer every day, and this problem has relatively gone unnoticed due to lack of media coverage and lack of general knowledge among citizens. Approximately 30% of individuals who are exposed to opiates develop drugs misuse or develop an addiction to prescription opioids, and approximately 6% of those individuals transition to heroin use, which ultimately leads to tolerance and eventually death. That's why I believe that the national government should take more steps, and citizens should work with the government to help enact these laws to help save more lives. The typical individuals who become addicted to opioids are not your stereotypical junkies or drug abusers that you picture on the streets. They are hardworking Americans. They could be your brothers, they could be your neighbors, they could be your friends. They could be your friends. And opioid misuse is not a moral failure, but it is a disease of the brain. That's why I believe that the national government should enact stricter laws to regulate the use and prescribing of safe of opioid narcotics and opioid prescription drugs. Thank you.